Which of the following is not a known risk factor for diverticular bleeding? A, NSAID use. B, aspirin use. C, hypertension. D, smoking. E, antiplatelet medication. Please don't confuse it. We are not talking about diverticulosis. We are not talking about diverticulitis. We are talking about diverticular bleeding. So which of the following is not a risk factor, a known risk factor for diverticular bleeding? Doctors, please type in your answer. Looks like people are going for D, smoking. Some are also going for C, which is hypertension. So what's the correct answer? Smoking. Remember, we are talking about diverticular bleed, and I'm going to explain what the answer is. Smoking has not been shown to be associated with increased risk of diverticular bleed according to the studies. Okay, NSAID risk factor, aspirin is a significant risk factor. Hypertension has been consistently associated with increased risk of diverticular bleed. Antiplatelet medications are a risk factor for diverticular bleed. So which of them is not a risk factor? Smoking. Now, then I quoted the literature, and this literature was picked up from UpToDate as well. So you can see it in UpToDate. And if you go to the publications of these wonderful doctors as well, you will see it. In small case control studies, smoking and alcohol have not. So you need to master your risk factors for diverticulosis, and then master the risk factors for diverticulitis, and then master the risk factors for diverticular bleed. So smoking and alcohol have not been associated with diverticular bleed. Nut, corn, popcorn consumption are not associated with increased diverticular bleed. So doctors, what are the risk factors for increased diverticular bleed? Then, after we learned that nuts, popcorn, corn, smoking, and alcohol are not associated, what are the risk factors for diverticular bleed then, please? Can you tell me? Antiplatelets, NSAIDs, hypertension. Beautiful.